Hi, my name is Dr. Dale. I'm an electrophysiologist at the University of Pennsylvania. My clinical interests are in sudden cardiac death risk stratification. Specifically, I'm interested in identifying high-risk individuals for sudden cardiac death. I'm also, as an electrophysiologist, interested in ablation procedures, complex ablations, and defibrillator placement. Sudden cardiac death is death that is defined as occurring within 1 hour of the onset of symptoms. In other words, it is a spontaneous condition from which an individual dies due to a cardiac etiology or due to a condition that is from a cardiovascular disease process. Heart attacks or myocardial infarctions may result in sudden cardiac death. However, a myocardial infarction or heart attack refers to acute occlusion of a blood vessel that supplies blood and oxygen to the heart muscle, whereas sudden cardiac death may be the manifestation or the end result of a myocardial infarction or heart attack. Women, especially women who have a pre-existing history of cardiovascular disease, can and may present with chest pain, chest pressure, chest tightness, shortness of breath, dizziness, lightheadedness, the same sort of symptoms that we may expect men to present with, especially in a life-threatening condition such as a myocardial infarction or a sudden cardiac death event. We also know from past studies that women sometimes present with atypical symptoms. So I believe that any concern for a cardiovascular disease process, and that means any discomfort in the chest or in the chest region, or any difficulty in breathing, or any suggestion of lightheadedness or dizziness, warrants rapid medical attention. Our objective in this study was to evaluate, was severalfold. Number one, we were interested in evaluating and quantifying the risk of sudden cardiac death among postmenopausal women who were enrolled in the heart and estrogen replacement study, or the HERS study. In addition, we were interested in identifying clinical risk factors associated with sudden cardiac death and that would help predict sudden cardiac death events in the future. There's several important findings from this study. First, we appreciate that women with coronary artery disease, and specifically postmenopausal women with coronary artery disease, are at a high risk for sudden cardiac death events. Number two, and specifically, sudden cardiac death comprised 27% or over a quarter of all mortality events in this study. In addition, sudden cardiac death comprised the majority of mortality events among women who died of a cardiovascular disease process. We identified women who have a history of a heart attack or myocardial infarction, heart failure, kidney dysfunction, atrial fibrillation, diabetes, and physical inactivity as independent risk factors associated with sudden cardiac death. And specifically, women who had 3 or more of these 6 risk factors had a 10-fold higher risk of sudden cardiac death events than women who had none of these risk factors. The next steps are really to validate these findings in larger groups of women and larger cohorts. In addition, we need to prospectively assess whether the evaluation of clinical risk factors in an outpatient setting, for example, can really help us identify, and really does help identify, the highest risk group of women. Once we can validate these findings, we really need to develop novel therapies and implement current strategies of both preventing and prophylactically treating sudden cardiac death. I collaborated with several investigators from the University of California, San Francisco.